Everyone, without exception, should be able to get the health care they need, whenever and wherever, without facing financial difficulties. That sentence might sound simple and ordinary, but it turns out, for many people, it's not. So in this age of pandemics and superbugs, should healthcare be free for everyone? Today, almost all developed countries already have universal health coverage, except, you know it, the United States. Here, many consider that a system where health insurance becomes a mandatory government program will reduce the quality of service. A lot of people think that healthcare should also follow a free market system so that patients can get the best service. Not to mention it could increase wait times for basic care and instead make people's health worse. So then, why bother with universal health coverage, right? Well, it's not that simple. In fact, data says almost half of adults there faced medical debt problems last year. To pay off debt, those with it usually cut spending on basic necessities or deplete their savings, and some even file for bankruptcy or lose their homes. Yeah, the cost of healthcare is a concern and nightmare for many Americans, even those who haven't faced it yet. Nearly half of the lower middle-class residents deliberately postpone necessary healthcare because of costs. And shockingly, even high-income residents delay their needed care, too. Surprisingly, universal healthcare might just have the potential to save state spending while preventing people from going bankrupt. A study found that America could save hundreds of billions of dollars if it implemented a paid universal healthcare service. Another study found that implementing it would save tens of thousands of lives and millions of life years every year. Many other studies have shown that the existence of universal health coverage can improve individual health and ultimately national health. It lowers child mortality, depression rates, and smoking rates, and it can make life expectancy longer. Around the world, many other countries have implemented universal health coverage and succeeded. So now the question is, how can universal health coverage be implemented? First, the country must make this a priority and create a sustainable funding system. For example, in Rwanda, they manage community funds together, where members contribute based on income. Rwanda was able to increase the utilization of health services and financial protection, especially among the poor. And then, of course, there must also be efforts to break the cycle of poverty and disease, including improving health services in rural areas. There must also be a separate focus for the needs of vulnerable populations. In the end, there are still many challenges to be able to truly implement universal health coverage, but perhaps now is the right time for us and policymakers to see public health insurance not as a cost, but an investment, one that can bring many benefits to the country.